A couple of questions. The first question I have is for Mr. Osoup. You said that the bill C-45 does not fully recognize the harmful effect of cannabis on the developing brain, and we've heard different suggestions about how best to mitigate that risk. From raising the minimum age to purchase the cannabis, to restricting cannabis qualities and the potency for those aged 25, as you suggested. Can you tell me why limiting the potency or the whatever you call it, the potency, with the THC would be preferable to raising the minimum wage, and how might that work?
Well, I'm not a doctor, so somebody else might be able to answer this better on the stand here. But my understanding is that from the age of 18 to 25, different potency levels have different effects on the developing brain. So I'm just speaking from that, from what I've read, but not as an expert at all. So I think that's why I make that statement, and that's why we make that statement.
Okay. Is there anybody else that has would like to add?
I would just like to really quickly comment on the THC potency caps. Like, we're just talking about cannabis varieties, dried cannabis, and I think we're really talking about restricting access to particular products for young adults. And I think that if we don't give them access to legal, regulated, tested products where they're able to know exactly what they're purchasing, we're really just pushing them to the illegal market to access the products that they want. So I think that it's really, it's important to think about that if you put restrictions on particular products, especially for that 18 to 25, 19 to 25 range, that they are just able to access them off of the illegal market. So I think that's also important when we're considering, what it means to protect young people. It might be a point of education and harm reduction to talk to them about those products, what their vulnerabilities might be, rather than banning them outright.
Okay. My second question is for Dr. Jenkins. You mentioned, and I took note of it, and I think I understood right, and I'm assuming this is based on research that you've probably done, that young men are more at risk than women are. If you could just expand on that a bit. And also you mentioned in your presentation that this research also indicates that the current approach to prevention education is ineffective. Could you share with us what you would recommend would be effective and what could happen that would make it better?
So I've been drawing on a recent study published by Leos Toro and colleagues. It uses data from the 2013 Canadian Tobacco, Alcohol, and Drugs Survey, and as well as the ASSIST tool for screening for problematic substance use. And in their analysis, they break down the various types and forms of harms, whether those are harms to health, whether they're social, financial, or legal harms. They also separate out whether they're harms associated with young people, it's both young people and adults needing to cut down or feeling that they're having trouble to stop use. And then they disaggregate by gender, and we find that harms are significantly higher in the young men who respond to the survey as opposed to young women. This mirrors evidence from other population-based surveys which show that the harms are concentrated amongst young men predominantly. Okay. To answer the other,
second part,
the second part of your question was regarding current education programs being ineffective, and that's kind of broadly speaking, when they are abstinence-based, which is what the majority of our drug education programs in schools are. Young people find them difficult to believe. They don't resonate with their own experiences and what they're seeing. And so we would advocate for drug education that is more pragmatic, that takes a harm reduction approach, that recognizes that young people are using, and so it's inclusive of that experience as well, and how do you minimize harms within the context of use. I think another really important point that I want to make here is that education is absolutely necessary, but it's not sufficient in reducing these harms. And so I think when we see that the harms are concentrated in these marginalized populations, that begs the question of why is that, and what can we do to try and promote outcomes for those populations. So I think drawing on mental health promotion lens, working with communities to build on strengths, to support positive relationships, to support opportunities for youth. Many of the youth that we've had in our studies describe using cannabis as something to do. It's simply they experience a lack of opportunity in their life. They don't have ways to be meaningfully engaged in their communities, and so cannabis is something to do with their time. And so to address those social and structural conditions that contribute to use is going to be important in addition to a strong harm reduction-based education campaign.
Do you have time left?
No,
Okay.
sorry.